Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Ari Khusuma, and today it's really pleasant for me to present our research on this special occasion as part of the international seminar on investment in laboratory animal science for precision in biomedical study. The title is Anti-Inflammatory Test of the Lombok Nursehat Herbal Remedy for Respiratory Tract Infections. And I would like to acknowledge the contribution of my team members. Itself is Ms. Lalu Budi Kusuma Dewi and Ms. Agrianti, whose effort were instrumental to this project and this work research. Okay, we start with introductions. Respiratory tract infections, particularly acute respiratory tract infection or RTs, represent a critical global health challenge responsible for a significant percentage of illness and mortality worldwide. The World Health Organization has flagged RTs as a major health concern, and with rising cases documented across various regions. Yeah, we agree about that because statistically in many countries show that rising cases years by years. Talking about background, we know that prevalence of the artist is really taking serious topic. We talk about seasonal trends of high incidence of this. According of Indonesian Ministry of Health, respiratory infection account for a sustainable proportion of communicable disease, particularly in rural areas where healthcare access is limited. The causes of this RDs is really serious in international. We talk about viral infections and bacterial infections, or maybe something rare. We talk about fungal infections. This is really serious because of the case really high day by day. Relevance topic of this case of RDs is about inflammation, lymphocyte and histology of lungs. It's sort of inflammatory marker can predict result of RDs, and this one can be a warning of us that something happened in our body and the warning of acute infection. Are nasal irrigations. Nasal irrigations is something that maybe you heard regularly, especially when COVID. And nasal irrigation is a procedure that cleans mucus and debris from the nasal cavity, optimizing respiratory functions. This is something common solution. Maybe we know that people using sodium chlorine solution and anything else. And we know that in traditional way or traditional method, everybody knows as Gura in Indonesia. This method is recognized. Prof. Sudomo from University of Gajah Mada is found out that Gura itself is really useful for chronic rhinosinusitis symptom. Research finding that patients undergoing Gura show a lower recurrence of sinus after 3 months compared of those who did not receive the treatment. So based on these things, we talk about another research about nasal irrigation that show about nasal formulation represent a vital avenue for drug delivery. And based on this research of nasal irrigation is already developed by formulating of herbal nasal formulation using extract from the herbal or plants. So the research plans of this one is anti-inflammation and Nursehat itself, and we want to do and explore and discover about Nursehat itself in laboratory and animals models. So this one of this research want to know about anti-inflammatory of Lombok Nursehat herbal remedy for the treatment of respiratory tract infection in animals models, especially in Wisdom strain white rats. Okay, everyone maybe have something in their mind. What is Nursehat itself? Yes, this one is Nursehat. Nursehat is like this. You can see on the screen that Nursehat is contain of many kind of herbs. On the screen about 1, 2, 3, and 9. Yeah, 9 of herbs. It's contain of traditional herbs, especially from Praia Center Lombok. This one, yeah. People in Praia Center Lombok using Nursehan to washing their nose by boiling into the water, warm water, and use them to rise their nose if they have flu or cold or something else. So based on this experimental procedure and the evidence in the social that show the method of this research. Okay, let's continue to methods. This research using experimental design and using 25 Western strain white rats, Rhotus norvegicus, and we want to know about anti-inflammatory of Nursehan itself. The methods, it's really tough with preparation, and we divide it into another step. We can start with step 1, step 2, evaluation, and the final research. This one, the first thing is preparation. It's really important to have ethical clearance, and we got it from Komisi Etik Penelitian Kesehatan Politeknik Kota Mataram with the numbers itself and the preparation of the groups. We divide it into the 5 groups, that from negative control, positive control, drug control 1, drug control 2, and treatment or P. Drug control 1 is induced by Streptococcus sp bacteria and given intranasal drug, nasal irrigation solution. And control 2 using antibacterial nasal drug, and the P1 is using Nursehan solution with 50% concentration per nostrils. And this one on your screen is about step 1. We want to make sure that every step is really important for us, and make sure in every single of rat itself can be infected by bacteria. So we use swab sample testing almost every day, in day 1, day 3, and day 6 after administration, to confirm that presence of bacteria in rats' bodies. And we want to know that in day 6 what happened with the nose of the rat itself after we do washing with the Nursehan and the control, and we find out in the result itself. And the second step, talking about preparation for Nursehan treatment in blood collection for hematologists and using group treatment. And it's really interesting because this is using the specific hematology analyzer for animals, so it's really rare find out in Mataram, and you really glad, happy, and really enjoy to do that, and collaboration with Dr. Hewan or veterinarian. And the last thing we can do is after blood collection, the rats are euthanized and lung tissue sample are collected for further analysis, and we send the sample to veterinary center in Bali. Okay, next is result and discussion. From this research, we find out the 3 important things of our research. The first one is the presence of bacteria in the nose as indicated by the swab results. Number 2, an increase of lymphocyte count might indicate the presence of inflammation. And number 3, the presence of tissue damage and an active of immune response, which are characteristic of infection and inflammation in the lungs of animals. This one is the result of the first result. We talk about the swab of day 3 till day 6, so the similar things. We can still found the infection of bacteria even we already do of the washing using Nursehan or maybe using the control. The results show the same thing. We can find out in day 3, day 6, or maybe day 7 still find the same things. And talking about the result, we assume that bacteria adhesion may be performed of this effect. Bacteria such as Streptococcus have the ability to adhere to the tissue and the mucosal surface of the respiratory tract, making it really difficult for washing to remove all firmly affected bacteria. And number 2, we are talking about biofilms. Some bacterial species can form biofilms, which are protective layer that allow them to survive on surface. This biofilm makes washing less effective in eliminating bacteria. It's already known that bacteria biofilms on the research of current tea and stain mix. And another assumption about this one is source of contamination. The environment and the equipment for washing maybe is contaminated, so bacteria may re-enter the nasal passage of the rats after washing. And the second is lymphocytes. The range of BBC is around 0.8 to 6.8, and we know that the result from day 1, day 2 till day 7 is really fluctuative. It's already analyzed using hematology analyzer, and in every days show different result. But in the end of the day 7, show that all of the groups show that almost on range of normal. So it's quite shocking me and my team that in day 7 all of the group show the range of like BBC and normals. So this one is already discussed by our team. The first thing about recovery process. Maybe after washing, the rat body begins to recover from the stress and infection that was present beforehand. This recovery process can trigger a balanced immune response, allowing lymphocyte count to gradually return to normal. So maybe if we continue our research into day by day, so that's lymphocyte count back to normal. Yeah. And the second, we talk about reduction of immune stress. The washing is performed correctly in all of the groups and doesn't cause additional trauma, so the condition of the rat can be improved. So reduce immune stress really help to restore lymphocyte level to normal. And the last one is already debating, talking about resolution of inflammation. So that's all about lymphocyte. The last one is histology of lungs. This one on the screen talking about histology of lungs that already examined by Balai Veterinary of Bali. This section, all of the group show that characteristic of bronchopneumonia interstitialis. The K of the indicator identifying feature of bronchopneumonia interstitialis is about alveolar wall, show that thickening and alveolar spaces and bronchiolus and bronchial involvement, and the last one is inflammatory infiltrated. So this one is know that lungs have damage of infection of the bacteria. So talking about these results, especially in histological, our assumptions is about pathogenic ability of bacteria. Yeah, Streptococcus has the ability to cause really serious infection in lung tissue. Even after washing, bacteria can remain with it in the tissue or respiratory system, leading to further inflammation and infection. And another assumption of these things, sustained inflammatory response. Bacterial infection can trigger or persistent inflammatory response. And the last one is really interesting. We talk about spread of infection. Bacteria can spread through the bloodstream and lymphatic system to other area of the lungs, causing tissue damage even if preventive measures have been taken. So based on this one, we assume all of these things maybe can happen into the lung of the rats. So the conclusions of all of this research, we talk about bacterial infections. Bacterial infections can still be found in rats infected from the day 1, even after washing has been performed both in control and treatment groups. The second one is the decrease of lymphocyte counts after washing, nasal washing, suggests that the procedure may be effective in reducing of inflammation. That's really indicate that washing using a control or Nursehan itself help clear the respiratory tract of pathogen or inflammatory product. So it's really interesting. Talking about Nursehan, based on this research, demonstrate really effectively efficacy and comparable that so that pharmacological control by reducing lymphocyte count. So this one is really interesting for us, but it's not effectively to reduce or eradicate the bacteria present within the nasal cavities of the rats. The last one is damage of the lungs itself. So the bacteria infection can trigger off persistent inflammatory response, while washing maybe can help to reduce the bacterial loads and the inflammation that's already occurred and continue to affect lung tissue, leading to the development of interstitial bronchopneumonia. So, in this conclusion, our study indicates that Lombok Norsihan herbal remedy has significant potential as an anti-inflammatory agent. That's ability to modulate immune response without eradicating bacteria suggests it could serve a supportive therapy in respiratory infection, particularly where traditional treatment might not be feasible. And for the further studies could explore the integration of Norsihan with existing antibacterial therapies for more comprehensive treatment approaches. Okay, thank you for all of your attention. I'll be happy to answer any question regarding our study, and I invite you to reach out me by email at khusumari.com for any further discussion or collaboration opportunities. Thank you.